All right, so today's presentation for Caregiver Week in the province of Saskatchewan is brought to you by the Saskatoon Council on Aging. The Saskatoon Council on Aging, or SCOA, serves over 80% of the adults in Saskatoon and area. SCOA is a nonprofit organization which began operations in 1991 and is dedicated to promoting positive aging for all in an age-friendly community. SCOA presently has over 4,000 memberships. Please visit our website at www.scoa.ca for programming, services, and all of your older adult information. Good afternoon, and my name is Dori Krahn, and I work for the Saskatoon Fire Department. With me here presenting this afternoon is Janet Barnes, who I'm sure most of you know. She's a SCOA volunteer and a past president. So we've planned some time for questions at the end of our presentation. And if you have a question, please leave it in the chat section. At the end, either Janet and I will read out the question and then we'll respond appropriately. So let's get started. Remembering When is a fire and fall prevention program for older adults and was initiated in Saskatoon in January of 2017. We ran our pilot project in the Market Mall area, and then in 2018 started the full program. In 2018, we also moved to include the lift assist done by the Saskatoon Fire Department to be part of the program. So that might interest you a little bit because in 2020, the Saskatoon Fire Department actually did 1,150 lift assists. So those are 1,150 times that somebody was stuck on the floor and wasn't able to get up, and the fire department responded to help them out of that situation. So it's coming from that point that we actually know how detrimental falls are and led to the start of this program to prevent fires and falls amongst older adults. So in 2018, or in April of 2018, there was actually another move forward for the program, and we signed an agreement with the health authority. It was then the Saskatoon Health Region, to share contact information for people who we had lifted and who signed consent. So we don't do everybody, we just do the people that would like to have that opportunity for them. So the health authority has been a very big partner of ours and made a really difference in our program being a success. So the goal of Remembering When is to make sure that everyone gets help before we have lifted them 5 times. So that doesn't mean that we start getting them help when we've lifted them 5 times. We actually start right away on the first lift, or else even proactively when we do group presentations and home visits. But our goal is to make sure that people get the help that they need before then. So let's move on and let's talk about the fire prevention messages. So like I said, I'm going to do the fire prevention messages, and then Janet is going to do the fall prevention messages. So just a little bit about some information to explain the problem to us. So of the Canadian seniors, they are 2.5 times more likely to die in a structure fire than younger people. So that's a really disturbing fact, and we know that older adults need to be a little extra careful when it comes to fire safety. Because by the time you get to be 85 years and older, they're 3.5 times more likely to die. So we expect fire fatalities to increase amongst seniors if we don't do enough work to prevent those fatalities, which is sort of the impetus for this program and a few others. So far, seniors have accounted, and this is in 2021, but the seniors actually account for 50% of the fire-related deaths, and that meant they were 1/3 of the total. Now, the problem came when we matched that up to and realized that the older adults equal 14% of the population, and yet are still accounting for 33% of the fire deaths. So something we really need to take note of and make work to fix. So here's a quote, and without the focused effort to ensure that senior residents have appropriate operational safety equipment, the annual fire death rate of seniors is expected to climb to 90 to 140 fatalities in the next 25 years. So you remember I told you that it was 50 fatalities and expected to go up substantially. Now that operational safety equipment, that would refer to sprinklers and smoke alarms. And so we're obviously going to touch on that in some of the the messages that we're talking about today. So the very first message that we have for people, and we start with some of the practical stuff and then move to the smoke alarms, is if you smoke, smoke outside. So one of the things that I've learned since working with the fire department is that it's people get complacent, and it's the things that you do every day that and you sort of get away with cheating a little bit that eventually cause fires. And smoking is exactly like that. Let's say somebody has 10 cigarettes a day, which isn't even an unreasonable number, then that's 10 times every day. They've got a little bit of fire at the end of that cigarette. And if it doesn't catch on fire or start a fire, they think, oh, well, it's no problem. And then they throw it here and throw it there, and it's never a problem, never a problem. And then one day their house catches on fire, right? So it's challenging in that way. And I see that in other areas too. So complacency is a big challenge for us. Now, some of the ways to avoid um, fires from cigarettes. Well, the first one is if you smoke, smoke outside. And that's been a change that's been happening in our society for quite a number of years now. But we at the fire department would also suggest that you have a sturdy container that you're going to butt your cigarettes out into. And that sturdy container actually has a lid on it. Because every year we see a number of fires where somebody was smoking out on their deck, and then the wind came, blew that container over, and then the fire started from that. So people don't realize that there's a lot of chemicals added to cigarettes, and some of the chemicals are added to actually keep that cigarette burning longer and longer. Now, maybe some of you remember the good old days when a person had to almost keep smoking that cigarette, otherwise it would go out. So they've fixed that problem by adding more chemicals. But that has also meant that the cigarettes stay hot longer and can start fires much longer. So if you smoke, smoke outside, and never smoke with medical oxygen. Some things there's a little wiggle room and places to be careful, but medical oxygen is not one of those instances. When you work at the fire department, I've actually seen people that have had a fire start right in their face because they were smoking and while using medical oxygen. And oh my goodness, that is not a pretty sight. Those burns are quite horrific. So if you smoke, smoke outside. If you give space heaters space is the next message. So space heaters need at least 3 feet away from anything that can burn. And that means furniture or curtains or newspapers or stuff lying around that you've got, clutter and different things. 3 feet away. So at the fire department, we also recommend that you don't plug your space heater in with a plug-in, which generally means that you have to move furniture because you've got a very small spot where it's actually able to put that space heater, and then you need your furniture at least 3 feet away. Now, this is a fire and fall prevention program, and so the other thing I want to caution you about is that plug-in. Make sure that that's not a trip hazard, and that it's not going across someplace where you might be walking. So space heaters are always a challenge, and we would suggest you be really, really careful when you're using a space heater. Make sure that you turn them off before you go to bed, and don't put them in your bedroom either. There's been the cases, and I've seen this, where somebody's blankets have slipped off the bed, got into the space heater, and then that's when the fire started. The next one is stay in the kitchen when you're frying food. And I always change that, stay in the kitchen when you're cooking food. So cooking is the leading cause of fires in Saskatoon and actually in Canada and in North America. In Saskatoon, it's been the leading cause of fires since they just didn't allow us to burn our rubbish in our backyards anymore. So some of you might remember that. That was quite a while ago. So stay in the kitchen when you've got food on the stovetop. Because you know what? It's this cooking is just like smoking. It's something we do regularly, and then we get away with things, and then all of a sudden there's a fire, right? So my thinking on this matter is I don't know anybody that would feel comfortable leaving the kitchen when they have the tap running to fill the sink. So when we've got the tap running, we're not running off and just putting the laundry into the dryer or getting the onions from the basement. When we have the tap running, we stay there or else we turn it off. And I'd like to see everybody do the exact same thing when they're cooking. If you need to leave the kitchen when you're cooking, just pull your pot off of the burner and turn that burner off. Then you know you'll be safe until you come back. And I've been working for the fire department for almost 12 years now. And I think about this all the time. I hate to be the person that tells people to do something and not do it. So I don't do that anymore. And I've turned my burner off so many times when I needed to run to that other fridge to go get something, right? So stay in the kitchen when you're cooking. Now the slogan that I like to use is that stand by your pan. It always works really good to remember that when you've got something on your stove, you need to be there. Let's just quickly go over what you would do if you had a fire in your kitchen. Oh, I'm going to back up. If I have been talking about stove tops all the time, but if you got something in your oven, make sure you take a timer with you. Timers are great, and there's some that you can actually clip onto your shirt, small little ones, or set the timer on your phone, something like that. Make sure you set a timer when you've got stuff in the oven. That will prevent fires as well. So if you got a fire on your stove top, take a lid, slide it up and over the pan. Now, I don't want you to just plunk it down from on top because that could have the flames going everywhere. So slide it up and then over and just fit that cover on. Then when you can reach back, when there's no longer flames licking everywhere, turn off the burner. So fire actually requires three things. You need to have heat, you need to have fuel, you need to have oxygen. So when you take away any one of those things, you will actually smother the fire. So when you put the lid on the pot, you are controlling the amount of oxygen that the fire gets, and that will smother it. When you turn the element off, you're actually controlling the heat that the fire gets, and that will also contribute to it going out. So think about those things. Now, if you have a fire in your oven or your microwave, it's the same principles that apply, right? That heat, oxygen, and fuel. So if you in your oven, if you just turn your oven off, you're controlling the amount of fuel or heat that goes to your fire. And then if you remember to just leave your oven door shut, that will control the amount of oxygen that that fire is getting, and it will smother itself. And your microwave, the exact same thing, right? You need to turn your microwave off, but not open the door so that you control the amount of oxygen. Now, so many of us turn our microwaves off by either pushing that button to open the door or pulling on the door, whatever way it works for our microwave, right? So you need to find that pause or cancel button and then know where that is, because if you've got a fire in your microwave, that's the one you want to hit. That will leave the door shut and turn the heat off. Now, microwaves are very small and they have only a small amount of oxygen, and so those fires actually go out very quickly. So just some good information for you to stay in the kitchen when you're cooking food. Now, the next message is stop, drop, and roll. Now, who wants to stop, drop, and roll? I don't know anybody out there that wants to do that, and I can tell you that I'm old enough that I don't want to do that either. It doesn't feel good. So the key is then let's prevent it, right? So you stop, drop, and roll when your clothes catch on fire. And in my opinion, the best way to stop your clothes from catching on fire is to actually not cook with loose clothing on, right? So make sure that your clothing is nice and tight and close by you, right? That will really help to prevent fires. Sometimes we like to wear loose, flowy clothing because you know what? That covers up all the humps and bumps, and that's a good thing. But I would suggest to people if you've got a flowy sweater on, let's take it off before you start cooking. Or if you've got lots of flowy clothes, that's what aprons work really, really good for. So make sure that you're careful with that. In my opinion, the next place to get a fire or that you need to stop, drop, and roll is when we're sitting around the fire pits. So just be careful there and be aware that sometimes those sparks fly out and you need to be careful. So we want to talk just a little bit about burns and make sure that people are aware of what to do if they get a burn. So burns, I mean, that's always an accident. And I think most of us have had a burn. Either we've got too close to the iron or the racks in the oven or even something hot outside that we're working on for some of the men, some of those metalworks, right? Burns happen. The key to it is to get that burn in cool water. Now, often I'll ask people what are some remedies that they have. And you know what? The butter and the toothpaste and all those things, that is not recommended. But getting that burn into cool water is. So the logic of it is that that heat is actually spreading further and further out throughout your body, wherever that burn occurred. And if you get some cool water on there, that will actually stop it from progressing. And then you'll have a much smaller burn to heal. There's been times I know when we were moving into our house and I burned my arm ironing curtains, and I just wanted to finish, and so I didn't do it. And sure shooting for the next 2 months, I could show people the scar from that particular mistake, right? So we need to avoid that by getting those burns into cool water just as fast as you possibly can. Now, here we go. Smoke alarms save lives. This is so important. The research shows that the number of deaths caused by fire has been cut in half since smoke alarms were made mandatory. Just the little antidotes that I have show it much higher than that. We were looking at some old annual reports and know that in 1979 there was 15 fire deaths in Saskatoon. There hasn't been anything close to that. One, some years, but seldom, right? We have very few fire deaths in Saskatoon as a result of smoke alarms, but they have to be working smoke alarms, right? So almost everybody's got a smoke alarm in their house, but does it work, right? And what people don't know is that you need to replace your smoke alarm every 10 years. Now, they'll automatically assume that I'm only talking about battery operated ones and not the hardwired ones that they have in their house. That's not the case. All smoke alarms need to be replaced every 10 years. And it's not the wiring, it's not the battery that gets old. The batteries, of course, have to be replaced every year, but it's the sensor on that smoke alarm. And when the smoke alarm gets too old, that sensor either gets too sensitive or not sensitive enough. Now, we all know the ones that are too sensitive because those are the ones that go off all the time whenever you make toast, right? But you don't know the ones that aren't sensitive enough because you'd pretty much need to fill your whole house full of smoke before you go, huh, for some reason the smoke alarm didn't go off. I wonder why, right? So you need to replace your smoke alarms every 10 years, really important. Now, how do you figure out how old your smoke alarm is? Well, often they have a sticker on the side that will tell you what year they need to be replaced in. And if not, if you take them down, they'll actually have a manufacturer's date um, stamped on the back side that will tell you, well, this one was manufactured in June of 2005. Well, it needs to be replaced, right? So make sure your smoke alarms are replaced on a 10-year schedule. That's really important. The next thing is that you can actually hear your smoke alarm. Now you go, of course I can hear my smoke alarm. They're so loud. But what about if you wear hearing aids? Nobody sleeps with their hearing aids in. Can you still hear your smoke alarm, right? That's the question. So there's all kinds of cool smoke alarms out there that you can replace them with if you're hard of hearing. One of them is the smoke alarm just has a strobe light built into it, and the beeping will sound and the strobe light will go off, and that will wake you up. Some of the other ones are bed shakers and things. Now, the key for smoke alarms is that they were designed to wake you up when you were sleeping. Because if you have a fire on your stove and you're awake, hopefully you'll notice it. But if there's a fire in the middle of the night, you won't wake up to notice it. And the smoke will actually lull you into a deeper and deeper sleep. And so before smoke alarms were mandatory, people were actually just dying in their beds because they never woke up. So make sure that your smoke alarm is working properly, that you've replaced it regularly every 10 years, and that you can hear it. So important that all of those things are taken care of and come into play. All right. The next big message for the fire department is plan and practice your escape from fire. You know what? It's not enough to just plan it. Excuse me. You also need to run through it every once in a while, and that will teach your brain exactly what to do. Now, if you live in your own home, you need to know exactly how you're getting out. And normally, if your smoke alarm is working well, you will get out the same way that you got into your house, right? So if your smoke alarm goes off early, gives you lots of warning, you'll just walk out the door that you entered. That doesn't always happen. And sometimes you get stuck in a room and you need to know how you're going to get out of that room, right? But you always have two ways out of every house, the front door and the back door, or the side door, and those kind of things. So make sure you know exactly how you're getting out. And then make sure that you know how to open your windows in your bedrooms, because bedroom windows are required to open. They have to be at least 0.035 meters squared. So 0.35 meters squared, and at least one direction can't be more than 15 inches. right? So, or it has to be at more than 15 inches. So this, you can't have those skinny little windows that nobody can crawl out of. They have to open and they have to be big enough for people to get out of them. Make sure you have a plan. How are you going to get out? Now, if you live in an apartment, here's the plan. You need to, if your smoke alarm is going off, you need to leave your suite on your way to the stairwell because you're not taking the elevator, you're using the stairs. You need to pull the pull station. Then you need to get yourself to the safest place you can. And when you're safe, you need to call 911. Okay? So for sure, you have to leave your suite if your smoke alarm is going off. No ifs, ands, no matter what the challenges that you face, you need to at least get yourself into the hallway. So, which is the safest place that you can be? If your smoke alarm is going off, you're not safe in your suite, you're safer in the hallway, you're safer yet in the stairwell, and you're the very safest outside. So, depending on what your abilities are, get yourself to that location where you can be the safest place for you. Now, just to explain to you, the door on your suite is actually rated for 20 to 45 minutes. So that means that a fire inside your suite will not burn through to the hallway through that door for 20 to 45 minutes. So if you call 911, the fire department's going to be there in 6.5 minutes or less. So I'll just explain that to you. When you call 911, our dispatchers have 1 minute to figure out where we're going, why we're going, and who's going, and to dispatch the fire trucks. Once the trucks hit once the alarm hits the fire station, the firefighters have 1 minute to get the back wheels of the truck out of the station. If they're going to a fire, we actually give them an extra 20 seconds to put on their gear. Once they're driving anywhere in Saskatoon in 4 minutes or less. That is the standard that we adhere to and we strive to meet every single day for every single call. So we'll be there in 6.5 minutes or less. So if that door keeps the fire there for 20 minutes or longer, you'll be able to be saved by the fire department because the first thing we're going to do is rescue the people. The second thing we're going to do is save their stuff. In a fire in an apartment building, or any fire actually, we're going to come with 5 fire trucks. So there will be enough people to take care of the jobs that need to be done. All right, so that's get yourself to the safest place you can. And then let's talk about phoning 911. Who needs to call 911? Does everybody need to call? Well, we always say that more calls are better than none. It's been way too often that there's been an apartment fire and people are waiting for the fire trucks to show up, and then all of a sudden you get some person on the phone that goes, "Why aren't you here? The alarm's been going off for 20 minutes." Well, the answer is nobody phoned, right? So we're not sitting in the CN tower trying to figure out where the fires are. We're waiting for people to call us, and then we're going to send the fire trucks there, right? So make sure that someone calls. Now, if you get down there and there's 10 people there, just say, "Has anybody called 911?" And if somebody says, "Yes, I've called," then check mark for you. That's good. Somebody has called. Never assume, though, that somebody has been designated to call and they've done it. Sometimes in buildings that have a fire warden, that's a particular problem because they assume somebody called. But you know what? That person could have been gone for groceries or could have been away on holidays exactly that day. So make sure that you know that calling 911 is your responsibility and you need to do it. So next one, know your local emergency number. We've focused on this quite a bit. Make sure it's 911 and make sure that you call. Now, if you get out, you've got no cell phone. We've been calling 911 long before everybody had cell phones. Even I remember that. And you went to your neighbor's house to call 911, right? Well, there's still neighbors, there's still people out there. They're very willing to help you. Make sure you find somebody else to call 911 for you. All right, the last one is to plan your escape around your abilities. Now, regularly I'll hear stories of people who, I don't know, think they can jump off the balcony to save themselves. Well, that's not going to happen. Actually, just to make sure you know that your balcony is not a fire escape route and should never be used in a fire. But make sure that you can do the things that you have planned, right? Can you get down those steps? How are you going to do that? What's it going to be like when you get outside? What about the people that you live with? Is there a plan for everybody in your house, not just you? And actually, if you actually practice it and walk through that escape, you'll be much calmer when the time actually comes. So make sure that you can do the things that you've planned. All right, that's it for the fire prevention messages. Now we're going to move to the fall prevention ones, and Janet's going to take over.
Thanks so much, Dori. I'll maybe get you to go to the next
Yeah,
slide.
sure.
Okay, perfect. Okay, so across. Okay, I guess we're going to get this now. Sorry about that. So, across Canada, most hospitalizations from injuries are due to falls, and the number one reason why people end up in an emergency department. Um, and as you get older, an older adult over the age of 65 has a 1 in 3 chance of falling this year, and that increases to 2 times as likely by the time they're 75, and 3 times as likely by the time they're 85. And we also know that 95% of all hip fractures are due to falls. And today we're going to talk about some of the things that you can do to help prevent a fall from happening in the first place, and using a very common sense approach, just like with preventing fires. So this cycle here is called fear of falling, and it's a psychological condition where a person becomes very fearful of falling after they've fallen and hurt themselves, or they've witnessed someone else fall and saw the consequences of that fall. And it can become such a vicious cycle because you're fearful of falling. And so you do less activity, you become less active, your muscles get weaker, you actually increase your risk of falling. And so it's really important to sort of recognize that fear. But, families can also contribute to their family members, even though they're well meaning, but they can also contribute to that fear of falling for their family members. So, exercising regularly, this is our fall message, number one. So, I'm going to ask you to do a little experiment if you wouldn't mind. And so, if you could stand up, please. And I want you to be close to a chair or to a table that you can hold on to. I'm going to ask you to stand on one foot for 10 seconds. So if you can do that for 10 seconds, you've got pretty good balance. Okay, so here we go. We'll do it for 10 seconds, which actually is a fair bit of time. And I want you to pay attention to what's happening on the leg that you're standing on. Can you feel the muscles in your ankles kind of moving around? Can you feel your toes kind of trying to hold on to the ground? Okay, good. So maybe not too bad, but let's try the other side because balance can vary on different sides. So I'll get you to stand on the other leg now. And again, hold on to a chair or onto the table for that 10 seconds. All right, perfect. Okay. And now, if you think you're not doing too badly and that you think your balance is pretty good, again, standing close to the table or close to a chair, I want you to stand on your better leg. Um, and then I want you to close your eyes. Very good. Thank you very much. So, I guess I want you to think about now, you thought you had good balance. What's your balance like now? Do you still think it's pretty good? All right, you can sit down. Thank you so much. But what we do know that is if you have a fall, it is a person's inability to be able to recover their balance. And so exercising is so important, and especially sort of focusing on the balance exercises exercise portion to be able to work on those balance reactions and recover your balance and stop yourself from falling. So, most of the literature is saying that older adults should be active about 30 minutes per day or physically active. And we're suggesting as well, Health Canada recommends that you put in specific balance exercises 2 to 4 days per week for as little as 10 minutes a day. This can help you maintain the balance that you have and possibly improve your balance reactions, which in turn can help stop yourself from falling. Most older adults enjoy walking, that's the preferred activity, but it's not an exercise that actually helps you with your balance because it uses momentum to propel you forward. Balance exercises require you to slow down and focus on those areas that can help you keep your balance. And when you were standing on one foot and you felt your ankles and your feet and your leg strength, those are areas that balance exercise focuses on. And if you have a hard time motivating yourself to be active, you can join a Forever in Motion group. You can do exercise videos that are designed specifically for older adults. The fire department has exercise handouts and exercise kits we'll show you later. Tai Chi or yoga are also very good physical activities to take part in to help improve your balance. Okay, so taking your time. So why do you think it's important to take your time getting up? Well, people get dizzy, right? Your blood pressure needs time to sort of catch up with you. Now, we know that most older adults tend to fall more in the bedroom and in the bathroom. And it's often because people are rushing and often to get to the bathroom. But there are also places where people are turning, they're getting up from sitting or lying down. And so again, so that common sense approach just says take your time when you change positions from lying to sitting to standing. And it helps your blood pressure keep up. So the other thing I just want to mention here is that medications can also impact a person's fall risk. And so it's important to review your medication, including, prescriptions and over the counter with your doctor or your pharmacist every year, if possible, and especially if they've been changed. And please be aware that you're more at risk of having a fall when you're adjusting to a new medication or if the dose has been changed. And you usually would see the side effects of those sort of when you start the new medication and up to a week later. Okay, so message 3, keep stairs and walking areas clear. So again, pretty common sense approach, and Dori talked about sort of the cords from space heaters not being over your walking area. But be aware of sort of those unusual times in your home. And Christmas always comes to my mind where you've got your kids home, maybe your grandkids. There might be pets visiting that typically don't live at your house. And you're more likely to trip and fall on those things that aren't normally there. And so be aware of clutter at all times and remove it. Newspapers can be really slippery if they're left on the floor. Shoes at the front or back door. Pets, clutter on stairs, toys, those kinds of things. Okay, improve lighting in and outside your home. So as you know, and is that being able to see is so important. And do you remember when I asked you to close your eyes when you were standing on one foot? I think this is a way of demonstrating to you how important vision is to balance. In fact, I've heard someone say it was actually 80% of your balance is related to your vision. And so important to be able to see where you're going, and especially at night. So to have that night light that comes on to light your way to the bathroom at night. Turn on lights before going up the stairs. And important to see an eye specialist, especially if you have any specialized eye conditions, such as macular degeneration or glaucoma, cataracts. Have your eye prescription checked yearly. And if your glasses aren't adjusted, especially if you have the multifocal lens, consider going in and having those looked at. And if you wear the reading only glasses, remember to take them off before you start walking or going up and down the stairs, because it can really change your depth perception and increase your risk of falls. Okay, using non-slip mats in the bathtub. So the photo here shows grab bars in the bathroom, and they can be very useful for helping a person get in and out of a bathtub, and to sorry, off or when you're in the shower. It's also important to have that non-slip surface in the bathtub. So you could have a mat or those adhesive strips put in and a non-slip mat outside the bathtub or shower. And when you think about that area and that people fall more in the bathroom, it's because you can slip. And when you're turning, there might be a spill on the floor. And so when those areas are wet and slippery, it certainly compounds the possibility of you falling. Make sure to wipe up any spills immediately. And if you're showering and you know that your balance is a bit off, you might want to just open your feet a little bit and create what we call a good wide base of support. And you're much more sturdy on your feet when you've got your legs wider apart. Carry a cell phone with you or have a phone close by if you are at risk of falling in the bathroom. It's a long ways away from those things if you do happen to fall and can't get help. Bath stools are also a really good option. Or if you know yourself that you're at real risk, really consider looking into a personal alarm that you can wear and that you can call for help if you need it. So only use throw rugs that have good rubber or non-skid backing. And if you have a rug that doesn't have those, you can actually get sort of non-skid rug pads that you can put under the rug that would stop it from sliding. And any rugs in areas that could potentially cause you to trip, especially any rugs that are rolled up along the edge, can be a real concern. Um, okay. So be aware of uneven surfaces indoors and outdoors. So we've talked about throw rugs already and how important it is to have them as non-skid. But what happens is, as you get older, it's much more difficult to to have more flexibility in your ankle and foot. And so you might not lift your toes as often. And if you have a chronic health condition such as diabetes or Parkinson's, you really have a loss of flexibility in your ankle and foot. And so what happens is then, because of that, you trip on things more easily. And especially that rolled up throw rug. You might trip more easily on an uneven sidewalk outside or wrinkles and folds in your carpet. If you do have wrinkles in carpets or folds in carpets, please consider either having them restretched or to replacing them. I know we did one home visit where they were all over the person's home, and it actually did cause them to trip. And so it is one of those things you want to be aware of and keep them in good repair. Keeping outdoor steps and walkways in good repair, and that's a challenge for us living in a winter climate. And so certainly use ice if you or sorry certainly use salt on the ice to stop yourself from tripping. Also, non-clumping kitty litter I know has been used by some people to stop yourself from slipping on that, or from making it less slippery on that ice. There are agencies that actually help. So Services for Seniors is one of those who can arrange for a fee based on your income to have someone come and do that for you. So when you do find yourself on ice, as I did the other day when I was out walking, it was so slippery. I practice this. I walked like a duck, or some people say walk like a penguin. So you want to open up your base of support. So open up your stride and point your toe outwards, and you kind of waddle through it, but it gives you much better stability and helps you with your balance on the ice. But the tendency really is to want to put your feet close together and shuffle, and that's actually one of the worst things you can do. So again, just open up that base of support and waddle across the ice. Consider using a cane or a walker if you need one. Walking poles are also a very good option if you have poor balance. And with a cane, you can actually purchase a cane tip that helps with stability on snow and ice. And the walking poles also have that graphite end that will also help you as you walk on snow and ice. And if you're in a public building, try to walk on carpet runners because the floors can be really slippery and wet. So stairways should be well lit, both top and bottom. So it's important to see where you're going, obviously, and to hold on to a handrail when going up and down. I would say always have one free hand to do this, whether you're carrying laundry up and down the stairs or you're carrying groceries or whatever. And if you have to make 2 trips, it really is good exercise, and it'll keep you safe by keeping that one hand on the handrail. You don't want to fall down the stairs. It's if you fall backwards, you have very few balance reactions, and so the majority of times you're hurting yourself quite a lot, and you are at risk of hitting your head likely. So, as I mentioned before, wearing bifocals, multifocal lenses, or reading glasses can change your depth perception on the stairs. And so, again, remove them and put your hand on the handrail. I mean, it's best to have handrails on both sides of the stairs, just like in this photo, but certainly one handrail is better than none. And the last message is to wear sturdy, well-fitting shoes. And so if Dori and I were doing a presentation in person, I would ask people, so what would you consider to be a good shoe, a good sturdy fitting shoe? And a lot of people would say, well, running shoes, they're a really good one. And they are, except they're not very good on carpet. But so I think the message should be that it's important to consider wearing the appropriate footwear for whatever situation you're in. So, but they should have a closed-in heel that's a low heel with a non-slip sole, either with laces or Velcro closures. And the Velcro closures on shoes are a good idea if someone has swelling of the feet throughout the day so that they're adjustable. So those grippy socks that you can get to are really good on laminate or tiles or linoleum, but they're not great on carpet. And they're even worse with someone that has a chronic health condition such as Parkinson's disease. And the snow and ice that we talked about, wearing good boots with good rubber soles for good traction, but also to wear those ice or snow grips on your shoes or your boots are awesome. I know I use them this winter and they really work well, but always remember to remove them before going indoors because they're really slippery. The issue with those two is taking them off and on going into a store if you're walking to a grocery store or whatever, because they're not that easy and you have to balance on one foot, et cetera, et cetera. So they can be a little bit tricky. Okay, so what we're going to do next is we're going to show you 2 videos. One is a video on how to get up off the floor if you've fallen and haven't hurt yourself. And the second one is how to get someone else up off the floor. Thanks, Dori.
Have you fallen? First ask yourself, am I hurt? If you are, take a moment to evaluate. Can you call 911 and wait where you are comfortably or get help? Ask yourself, can I get up? If you think you can, do so safely by following these steps. Roll to your side. Place your arm out to the side at shoulder height. Bend your opposite knee. Reach up and across with your opposite arm. Use your leg to either push your body over or lift it to help you roll to your side. Push up onto your elbow. Walk your hands up to side sitting. Move into a kneeling position on your hands and knees. Crawl to a sturdy bed or chair. Place your hands on the seat of the bed or chair. Bring your knees close to the bed or chair. Lift your strong leg and place it beside the bed or chair. Ensure your heel is directly below your knee to help protect your knee and keep yourself more stable. Place one hand on your knee and one hand on the seat of the bed or chair. Push down with both hands and lift your hips up into the air. Once your hips are high enough, turn and sit yourself down on the bed or chair. Method 2. Getting up from a fall. Roll to your side. Place your arm out to the side at shoulder height. Bend your opposite knee. Reach up and across with your opposite arm. Roll over onto your stomach. Tuck your elbows underneath you. Lift your hips into the air and walk your elbows back. Lift up onto your hands and knees. Crawl to a sturdy bed or chair. Place your hands on the seat of the bed or chair. Bring your knees close to the bed or chair. Lift your strong leg and place it beside the bed or chair. Ensure your heel is directly below your knee to help protect your knee and keep yourself more stable. Place one hand on your knee and one hand on the seat of the bed or chair. Push down with both hands and lift your hips up into the air. Once your hips are high enough, turn and sit yourself down on the bed or chair.
Help!
Arnold, are you okay? Are you hurt, Arnold?
I don't know.
Okay. Do you have any pain anywhere?
I'm just dizzy.
A little dizzy? Okay, we're just gonna wait for a minute. Do you want to try and get up?
I have to.
Okay, so what I'm gonna get you to do is take this arm and raise it out to the side and take your top knee and bend it and straighten this leg. Good. Now Arnold, I want you to reach up and over with that hand, reach way up and over and push with this leg. Good. Now let's bring that top hand over here. Good. And you're gonna push up and get that other elbow underneath you. Push right up onto your elbow. Good. Walk right on up. Very good. Now turn onto your hands and knees. Good. Come right over to the bed. Bring this leg up. Good. Okay. Now, are you okay if I put my hands on your hips?
Yep.
Okay, I'm going to place my hands on either side of your hips, and I am in a good position. Now, we're going to say 1, 2, 3, up, and on up we'll go, okay?
Okay.
1, 2, 3, up. How are you feeling?
A lot better.
So what I'm going to get you to do is take this arm and raise it out to the side, and take your top knee and bend it and straighten this leg. Good. Now Arnold, I want you to reach up and over with that hand, reach way up and over this leg. Good. And you're going to push up and the other elbow underneath you. Lift those hips up, walk back, come onto your hands and knees, and come right over to the bed. Good. Let's take this knee and raise it up, and bring this forward. Good. Perfect. All right, I'm going to help you, Arnold, with the getting up. So I'm going to come behind you. Can I put my hands on your hips, Arnold?
Yep.
Okay. So we're going to say 1, 2, 3, up. And then on up, you're going to come, okay? Ready? 1, 2, 3, up. And turn and sit down. Very good.
Perfect. I hope you did get some good information from those videos, and they're going to be available that you can have a look at them again. So I guess just wrapping up, what can you do differently to prevent fires and falls based on some of the information that you've heard today? So, does your smoke alarm need to be replaced? So remember, it's only good for 10 years, and so you need to look at the date on that. Do you need to exercise more? So 30 minutes a day and adding those balanced exercises in there. Do you need to remove some of your throw rugs, etc.? So just think about what you can do differently and actually act on that. And so we can help you, and we offer over the phone. We could do a consultation with you. We could send you a home safety checklist that you could go through at your home. We also have the LED battery operated night lights that we could send you if you wanted. Dosettes for medication, because it's important to take those properly. And the home safety checklist I talked about already. So I guess at this point, are there any questions that we might be able to answer for you? I also, just before we move to that, is there was an activity kit donated for someone who is French speaking, if there's anyone here today that is French speaking. And so if you would be interested, what we've been asked to do is if you could put your name and your phone number in the chat box, but only if you're French speaking, and they'll do a draw for that. Okay, so I guess from now, can we look at maybe there's a few questions in the chat. And so, okay,
There is
so
actually, Janet.
yeah,
Okay, so the
yeah,
first one is,
yeah.
please provide exactly the best way to get up when you have slipped outside. Do you want to take that one?
I do, and I was actually going to talk about that, but I thought we were running out of time. So good thing. I'll do it right now. So you would do exactly the same thing as the first video. If you had not hurt yourself, you would sort of take some time, sort of assess where you were at, and at that point, you would try to get up onto your hands and knees, and then you would crawl to a place where you could, hold on to get up. So if you were downtown, for example, maybe it's a parking meter. It could be a light standard. It might even be a car handle. I've heard of people being able to do that. So you would crawl to that and you would use that to help hoist yourself up, if at all possible. And if there's someone that comes rushing to help you, um, ask them to stand by, but please try to do it yourself, because they may hurt you, or they may hurt themselves if they actually try to get you up. And so I hope I've answered that question, but the principles are exactly the same.
Thank you, Janet.
Yeah.
So the next question is, how about carbon monoxide detectors? And carbon monoxide detectors are very important. We've seen that over and over this winter. My goodness, it's like almost every month there's been a major carbon monoxide event. So what you want to do is you want to have a carbon monoxide detector on every level of your house. So just to make sure that they are catching the carbon monoxide before it's detrimental to your health. So, you know, at like levels at 800, you have 2 or 3 hours before you'll be unconscious. And at 1600, it's less than an hour, right? So you want those carbon monoxide detectors to give you the warning that hopefully will give you a warning before you even feel sick that there's carbon monoxide in your home. And so we used to tell people to put them right by their furnace because that's the most common place where carbon monoxide will be generated. But now they're actually saying anywhere. It's not necessarily by your furnace, but anywhere in your home, but one on every level so that you will be notified if there's carbon monoxide. So carbon monoxide detectors aren't mandatory yet, but we'll see what happens with some of the things happening at City Council. But they're not in the fire code just yet. They're in the fire code for new builds, but not for existing homes. But really important, and especially in our province and our country where we use heaters to heat our home, like the furnaces or whatever. So carbon monoxide will be generated wherever fuel isn't being burned completely. So in most homes, that's most commonly found by the fireplace and the furnace, but it could be your dryer if you have a propane dryer, or your stove if you have a propane stove, some of those things. So just take a look for everybody. Now that's a recommendation for carbon monoxide detectors, and very, very much, very life-saving device. Okay, so the next question, are there CO1 detectors for visually for deaf people? And I know that, you know what, I haven't seen them, is my answer to that. I have not seen them. So hopefully there's another way. A lot of carbon monoxide detectors, the one that I have in my house actually has a readout on it. So every time I walk by it, I look and I go, okay, it's still 0, we're good. So if it was a visually impaired or for deaf people, I would get one with a readout on it so that at least you could read the level on it and check it and make sure whether it's going off or not. So just for common knowledge, that the fire department will put on their breathing apparatus after 50 parts per million. So you don't want to be, you want that reading to be 0. You don't want it to be anything above that. And what do you do if your carbon monoxide detector goes off? That's another thing. The first thing you want to do is get outside, because the sign of carbon monoxide poisoning is that you actually feel better when you go outside. But then you want to call 911, get the fire department there to take care of the problem. So very similar to when your smoke alarm is going off, get outside and call 911. All right. Any other questions for anybody out there? Good. I think we're pretty much at the 2 o'clock spot. Yeah, maybe we'll just wait just a little bit in case somebody wants to type something in, but I think it's about time for us to wrap it up and say thank you to everyone. Janet, do you want to do that part for us?
Sure. Thank you all for joining us today, and hopefully we've given you some food for thought. But certainly, if you have any questions, Dori's got her contact information on the screen. And once COVID restrictions have been lifted and we're sort of returning back to normal, we are available to give a presentation, you know, at your condo building or your apartment or your seniors group, or, you know, in any place. We really want to get the message out, and And in the meantime, again, just we would be happy to chat with you on the phone. Send you out a checklist that you could do, and so because we really want to try and prevent whatever we possibly can. So thank you again for your attention today. It's much appreciated. We are always happy to spread this message. Take care, and I hope you have a great day. Thanks, Dori.